Welcome to Module 2. This video presentation basically will cover a review of the immune response, the normal immune system, and any alterations in the immune system. Specifically, alterations in the immune system will consist of, we'll go over hypersensitivity, anaphylaxis, and latex allergy in this presentation. I'm going to just do kind of a quick review of the immune system. Most of this comes from Chapter 19. It is a good idea. You don't have to memorize any of this or delve too deeply into it. However, you should have an understanding, a pretty decent understanding of the normal immune system and how it works. The reason for that is as we go through the abnormal immune responses such as HIV, Lyme disease, any of the diseases that are going to attack the immune system, it's good to have a good understanding of how it normally works. That way you can kind of grasp how these disease processes can cause issues with the patient. Inflammation and immunity are defense mechanisms of the body. Inflammation is an innate protective piece that innately we are given as a protective mechanism. Inflammation we are given, it's not something we can get from another person. It's an innate protective piece. Cannot be developed or transferred from one person or another. It's part of our innate immunity that includes the skin, the mucosa, antimicrobial chemicals on the skin, and our natural killer cells. It is critical that the body has the ability to produce an inflammatory response. Immunity is composed of many cell functions that protect people against the effects of injury or invasion. The immune response is not automatic, it's more of an adaptive internal protection that results in long-term resistance to the effects of invading microorganisms. It is imperative that these systems both work well in order to protect the person against diseases, microorganisms, and those kinds of things. The interesting thing about the immune system is it has the ability to acknowledge itself. It can tell its own cells from any kind of foreign cells. It has the ability to acknowledge when something is foreign and protect the body against it. This is called self-tolerance. It's the ability to recognize self versus non-self. And it's important that the body has the ability to do this so that it will attack things that are actually foreign to the body. This is just another picture just to kind of help you visualize how this works. The immune system, there's barcodes and certain proteins on each cell that helps the immune system identify which cell is self and which is non-self. It's sort of like having the correct key to get into the door. The self cells will have the correct key to get into the door. The non-self will not be able to open the door because it doesn't have the correct barcode. The cells that are identified as non-self are known as antigens. Antigens are proteins capable of stimulating immune response. Once the body identifies something as an antigen, it will it will stimulate the immune response. I'm just going to briefly review the organization of the immune system. First of all, just kind of talk about the white blood cells, how the white blood cells are involved. They are, of course, you probably remember from anatomy and physiology class or maybe microbiology class that the white blood cells we have to protect the body from the effects of invasion by organisms. The next slide that we'll look at is just kind of a picture on how the body produces white blood cells, where the stem cells come from, and basically where most of the cells of the immune system come from. They are not really one system, but the immune system is influenced by many systems, the nervous system, endocrine system, and so forth. But most of the stem cells that mature into the leukocytes, or all the cells that are involved in the immune system, are produced by the bone marrow, and that is in the next slide. This is just a slide that kind of is a good visual for the maturation of the white blood cells. So the bone marrow is where most of the stem cells are produced, and then they differentiate into specific cells throughout the body. And this is important just to kind of have an understanding of it as we talk about each of these blood cells, where they come from, and why anything that affects the bone marrow can actually affect the platelets, the white blood cells, the red blood cells, and all that stuff. We'll kind of talk about that as we go along in 150. So it's good to have a basic understanding of this picture here. So just kind of make sure you review that and just understand that the stem cells are produced in the bone marrow, and as the cells mature, they differentiate into a specific type of cell. So infection. Infection is something that occurs in response to when one of these organisms invade the body, and they actually are able to cause an infection. It's important to understand that you could have inflammation. Inflammation is just, like I said, it's an innate response to a microorganism that is trying to invade the body. If you get a cut, or it's something like that breaks the skin, you will have an immediate inflammation, and that is just it's produced as a defense mechanism, and we'll look at those different steps of inflammation in the next couple of slides. But it doesn't necessarily mean that something is infected. So it's good to know that there is a difference between that. So we'll talk about that as in the next few slides. These are specific white blood cells that are involved in inflammation. When there is an inflammatory response in the body, these cells, and these are specialized white blood cells. There's a good table on page 305 that kind of reviews what exactly these cells do. It's table 19.1. Just kind of make sure you review that. It's nice to know as a nurse in general that each of these white blood cells have a specialized part in inflammation. Neutrophils are the largest number of white blood cells that take part in an inflammatory response. So just kind of review that there in chapter 19 about the different types of blood cells, these 4 blood cells, and how they are involved in the inflammatory response. An interesting thing to look at is the situation termed as a left shift. Take a peek at that and define a left shift. That's something that is good to know as a nurse in your practice, because you'll hear a lot of physicians and other nurses refer to a left shift when they're looking at a CBC with a differential. So take a peek at that. That's on page 307. And again, just review this. It's not specifically on your module outline, but it's good to have a baseline understanding of these cells as we go throughout in UR 150. Phagocytosis. This is just a good picture about phagocytosis. It is in chapter 19. Again, just review this. This is just a visual on how the body reacts to an invasion, and how it has the ability, the immune system, when it's working well, it has the ability to attack an invasion and actually can ingest it and break it down and get rid of it. This is just a review of the 5 cardinal manifestations of inflammation: that warmth, redness, swelling, pain, decreased function. Your body is an innately, all of our bodies, if our immune system is working well, it is an innately response to an invasion with these 5 cardinal manifestations. Now, to a certain degree, they're beneficial to us, because by doing all of this, the warmth, the redness, the swelling, it's all about protecting us. So to a certain degree, this is something we want to happen. Because if it didn't happen, we'd be more susceptible to infection and bacteria and such. So To a certain level, it's absolutely needed, but then it has to be somewhat controlled because, as we'll talk about later in a hypersensitivity issue, it could actually get too much inflammation can cause problems. This is just a review of the stages of an inflammatory response. It just talks about in the first phase, there's the vascular changes, the constriction, and then when the neutrophil arrive, the white blood cells arrive and trigger new blood vessel and growth, and just basically how it can actually protect the body and help repair it. Okay, so we're moving on to immunity. And again, remember, your immunity is something that you acquire. It's not something you innately have, such as inflammation. So immunity is something that you acquire. Your body has to kind of learn to generate a specific immune response to specific organisms. This is basically done by the body being exposed to something, an antigen, and then building up an antibody. These are the different types of immunity. Natural active immunity is probably the longest acting. We acquire immunity and build an immunity different ways throughout our life. So just review these and just be aware that there are different ways that we do acquire immunity through our lifetime. And these are the same. Just continue to review these. Just read through these. Don't memorize them, but just kind of have an awareness that we do have different ways that we do acquire our immunity. Okay, cell-mediated immunity is very important, and I'm going to go through this just a little bit because it involves the T cells, which are involved in HIV as we go through Module 2 and kind of cover HIV as well. So it's important to understand kind of how the cell-mediated immunity works. The T cells are also known as the natural killer cells. There's a variety of subsets of T cells and they have a specific function. There are 3 subsets of the T cells that are the most important and play the biggest role in the development of immunity in the body. Those are the helper T cells, the suppressor T cells, and the cytotoxic T cells. So those are the 3 that play the biggest role in the immune system. So just kind of keep that in your back pocket as we go through and talk about HIV. These are the 2 different types of protection that are provided by the cell-mediated immunity. Helps protect the body through the ability to differentiate self from non-self and the development of cancer and metastasis and after exposure to carcinogens. So those are big roles that this type of immunity plays for us. Okay, so moving on to hypersensitivity. Most of this information is found in your chapter 22 in your IGGY book. And basically, hypersensitivity is when there's an excessive response to the presence of an antigen. So it's the immune response. The immune system is just responding excessively to something. And they can range for anything from just a patient having some itchy, watery eyes to a life-threatening experience that we'll talk about in anaphylaxis. There's 5 basic types of hypersensitivities, and those are outlined on page 384 in table 22.1. Type 1 is the immediate reaction, which would be the anaphylaxis. So we'll actually talk about anaphylaxis in the next couple of slides. But just make sure you review that table to kind of see the different types of hypersensitivities that can occur. Basically, what you can see is that the body produces certain antibodies in response to an allergen or an antigen. It's something that the body has recognized as foreign, and so it produces antibodies to fight against it and causes like an inflammatory response. Anaphylaxis is a type 1 hypersensitivity reaction. It is the most life-threatening. It can be most life-threatening because it occurs rapidly and can cause systemic reaction. This slide just kind of shows you all of the different things that can happen. The biggest thing being the swelling of the lips, tongue, and or throat. That's the most life-threatening thing that can occur, along with the respiratory wheezes and stridor. that can occur, can be the most life-threatening situation. It's very important that the nurse be able to kind of be alert to help this patient, most patients, prevent any kind of anaphylactic reaction. It's important to get a complete health history on a patient to determine if they have allergies and to help them prevent it, and teach them to wear an allergy bracelet, teach them to be aware of all of their allergies and be able to make sure that they make people aware of that, especially if it's an allergy to an antibiotic or any kind of medication or food. They need to be able to communicate that so that they can prevent any kind of anaphylactic reaction from occurring. It's important that any kind of anaphylactic reaction be documented very well in the medical record. So if a patient has an allergy, it's very important not to just list the allergy, but to list the kind of reaction that occurred and when it occurred, and whether it was a rash, whether it was an anaphylactic reaction, whether it just gave them itchy, watery eyes, things like that. It's very, very important to document all of that information along with an allergy. First, initial symptoms of anaphylactic reaction can be vague. It can be this patient feeling kind of uneasy and restless, a feeling of impending doom. So it's important for the nurse to be kind of alert and kind of monitor for this, especially if it's the first time somebody's getting an antibiotic, something they've never had before, something that they know commonly causes allergic reactions. If you look on page 388, table 22.2, there's a table that lists common agents that cause anaphylaxis. So it's good to be aware of those. The sooner the nurse identifies that the patient might be having an anaphylactic reaction, the better. The nurse needs to be alert and be able to identify it and then take the necessary precautions if somebody is having an anaphylactic reaction. On page 390, there's a great table, chart 22.3. It is very, very important that you know all of the emergency care of a patient with anaphylaxis. That's something that you definitely need to look at and be aware of. And the first thing would be to immediately assess the respiratory status. That's the first thing you do. And that kind of determines how quickly you're going to move. If somebody is in very obvious respiratory distress, then you're going to move much faster. So that's the first thing that you need to do. Calling the rapid response team is going to be your next move. So just kind of make sure you look through that table. Those are things that you absolutely need to know as a nurse in treating a patient with an anaphylactic reaction. Could save lives. The medications that you will need in treating a patient, epinephrine is your first line for sure. A lot of people carry EpiPens. If they have allergies to bee stings or peanuts and things like that. So they need to have it on hand. That's the first thing you need to grab for when you have somebody that's having an anaphylactic reaction is your epinephrine. That drug works to constrict blood vessels, improve cardiac contraction, and dilate bronchioles so that someone can breathe better. Second line is diphenhydramine, and it's an antihistamine. It is given it's known as Benadryl. Most people know it as Benadryl, so it would decrease that histamine response and decrease the angioedema or itchy rashes. So first epinephrine and then your diphenhydramine. Okay, just going to review latex allergy. Latex allergy is actually kind of decreasing. The incidence of it is decreasing because they have taken most of the latex products out of the hospitals, and there's a lot less exposure to latex these days than there used to be. And basically, it's a type 1 hypersensitivity reaction, and it was just a reaction to there's a protein found in the latex that people were having a hypersensitivity to. The important thing to know about latex allergy is that not only do you need to ask them if they have any known allergies to latex, but there are some food allergies that actually can cause cross-reactivity. So if they're allergic to a certain type of food, you could also be allergic to latex. So it's important as a nurse to understand this. Apparently, it's due to the protein. The protein that is found in latex is actually in certain foods. So those foods include banana, kiwi, papaya, avocado, So they're pretty common foods. So if somebody tells you that they have a food allergy to any of these, and I think there's more on the list, but it's a lot of common fruits and vegetables. So if you have someone that tells you that they have an allergy to any of these foods, it could mean they have a latex allergy as well. Now, it's not quite as concerning in the hospital these days because we have removed most of the latex products, but it is something to keep in mind if you look at somebody that has maybe a large list of food allergies, to kind of look that up and make sure that it's not something that could actually be a latex allergy as well. So it's something very important to be aware of as a nurse. And that concludes this portion of the voiceover presentation for Module 2. The next few slides are just a few questions, and I will post the answers for those, and I'll post the PowerPoint without the voiceover as well for those of you who like to print these out. And please let me know if you have any questions. Thanks.